Hello and welcome to Health 2020. I'm Dr. Sello Daoud.
And I am Dr. Doreen Munakisi. Diabetes is one of the biggest health problems affecting people of all ages in our country.
Unbeknown to them, half of people with diabetes can remain undiagnosed for many, many years.
We speak to an expert on sugar diabetes who will help us discover and understand the condition a lot better.
But first, let's take a look at this.
Globally, 1 in 10 people are diabetic. We met up with Brian. He is a type 1 diabetic.
Ukuthola kwami ukuthi type 1 diabetic ngathola like at the age of 7 years. So, but before bengilezi ngumntwana ogulayo ungena esibhedlela ngiphuma. But age of 7, it's whereby they told my family ukuthi nginoshukela. I was admitted esibhedlela and they told my family ukuthi now I'm diabetic. Kumele ngicala ukuhlaba insulin. So in my life. Ukujova kwami like abanye abantwana when I was in primary it was okay, but when I come to be a teenager manje ngihamba to go to high school, it's where the scenario changes because now I have to inject myself ngisesikolweni before ngiyedla, because now I have to do it 3 times before ngiyedla my lunch. I have to go and inject. So my peers, they thought I was using drugs because at the time diabetic, it was known that umama, my dad and my mom, they were diabetic. So they've got this information that always they will teach me about diabetic, ama do and don'ts with sugar. But as young, you want to belong. So it becomes more difficult to go to uhleli nabanye abantwana, and then now you have to uhlabe. They don't understand ukuthi kwenzakalani. When I went to coma, like I took my insulin, nahlaba, but I didn't eat. So I feel dizziness and ngawa endlini. They call it ambulance, then I went to Espedler. From hospital, like when I wake up, I saw my mom was there and the doctor was there saying, give me welcome back. Say, welcome back, where I was. So now he started to hint me, I nearly died. Because of Nangena coma, I nearly died. So I must start taking Ushugala serious every day.
Brian also manages a support group of people with diabetes.
Okay, my support group mainly abogogo nabomkhulu nabobhuti. What we do, we come once a month in the facility, in the clinic. We do sometimes exercise. We help them exercise. There is a doctor that is coming, is checking their file. But tata ama vital swabo. Then we discuss impilo zethu ukuthi what's happening in our life. So we encourage each other. We support group, we educate ourselves.
We also caught up with Sillo, who's a type 2 diabetic.
Ukuthi ngi-type 2 diabetic ngithole 7 years ago. Before ngizo-realize ukuthi ngi-diabetic, bengazi ukuthi kwenzakalani ngento bathi diabetic. Ngiqale ukurealize after find out ukuthi ukuthi kusona. Ngiqale ngokudla futhi ukuthi ngikhathe isalt, ngikhathe amafutha, ngibheke i-diet engizoyidla ukuthi ukudla okunjani, ungadli kakhulu ukudla kune-starch. COVID-19 nenayo i-lockdown is-affecte kakhulu njengoba bekuvalwe nendawo la sino-exercisela khona. I-support group yethu is number 1, it's perfect. Manje njengoba sine-support group, siyafika singene e-bathroom sihlale, and then baphula ama-file wethu basinikeza i-treatment. Within an hour nje siqedile siyaphuma sihamba under i-support group yethu.
To help us unpack all the important facts that you need to know about diabetes is our special guest, Dr. Sandip Ruda. He is a specialist endocrinologist and an associate lecturer at the University of Witwatersrand. Welcome and thank you for joining us, Dr. Ruda. Just to start off with, exactly what is diabetes? We heard from the insert that there's a type 1 diabetic, there's a type 2 diabetic. What is diabetes exactly?
So, diabetes mellitus is a condition where your body is unable to remove sugar or glucose from your bloodstream to deliver it to the tissue. So what happens, the sugar accumulates in the bloodstream and can damage your arteries. Type 1 diabetes is a particular form. It's the rarer form. It happens in young patients, as you saw in the video. And that patient really needs insulin from a very young age because the cells that make insulin, which lower the blood sugar, have been destroyed very early in life due to autoimmunity or some virus. We're not sure about the cause very clearly. Type 2 diabetes is very important. That's the big component in the world. More than 90% of patients have type 2 diabetes, which is related to lifestyles, bad diets, not enough exercise, stress can play a role, smoking, and a little bit of family history that we need to be aware of. So that one is a modifiable one largely, and it's more common, so it's something that needs a lot more attention in the world at the moment. Yeah.
Let's just stay on that. I mean, you've described type 2 in terms of, who perhaps the question is, who's more vulnerable to get diabetes and why?
So the type 2 diabetes group, risk factors that have been identified is as we age, we're more at risk of it. And then I've already mentioned unhealthy diets, so eating lots of processed foods. In fact, I don't even call these things junk food, I call them products, Being sedentary, smoking, having a family history of diabetes. In women, very important risk factors are having large for gestational age babies. So if your baby is born with a high weight, maybe an indicator, having sugar issues during your pregnancy. So these are all things that can, and being overweight and obese, there's a big correlation with that as well. So these are the patients that people should be screening more regularly to have their blood glucoses checked. Yeah.
I mean, what are the signs and symptoms of diabetes? How does a person know that they actually have diabetes? What's the diagnosis? How is it made?
So specifically with the type 2 diabetes, there can be a silent, what we call prodrome. So for many years, you're just gaining weight. But at the point that that system breaks and the blood sugar becomes high, you may have a slight weight loss initially, but then symptoms of fatigue, excessive thirst, passing lots of urine. You may even end up in an emergency of diabetes if it's really far gone, called ketoacidosis. You can end up in hospital, short of breath and very dehydrated. You may get poor wound healing, recurrent infections may be a sign as well. So these are some things to look out for.
Well, I understand. I mean, what you're describing is really the symptoms that you have the condition. But oftentimes, as you said, people can go for many years undiagnosed. Why do we need to worry about diabetes? What are some of the complications that can set in?
You see, we often call it a silent epidemic because the damage is happening within the body without you knowing it. And the reason we treat diabetes is to prevent certain very severe or drastic complications. And these complications can be anything from a heart attack, a stroke, gangrene, which can lead to amputation of a foot, nerve disease of the foot, numbness. They can get eye disease, anything from cataracts to blindness. And you can get kidney failure as well, which often, if it's advanced, requires dialysis. So when you think about the severity of complications, it makes sense to try and prevent it through good control. Another thing that's coming to the fore currently with the COVID pandemic is that, we are more prone to severity of infections. In general, we've seen this trend that the poorer our sugar control, the higher your rate of infections or severity of infections in many different scenarios.
In fact, that's a very important one. I mean, you're talking about severity of COVID, illness with this. But let's just clear one thing.
Yeah.
If you have diabetes, are you necessarily at risk of being infected?
So it hasn't been shown that you're more likely to get infected. I think standard measures still apply there across the board. But what we're saying is that if you do get COVID-19 and you have diabetes, there's a higher risk of it being severe, meaning needing hospitalization or ventilation. There's even, unfortunately, a higher risk of death if you have diabetes. So it's important, it has been shown, that better sugar control can reduce that risk of severity to some degree. Okay. And that's important.
Well, guys, there you have it. You heard from the specialist himself. We'll be taking a quick break, but when we come back, we will be listening to some of your concerns, especially those affected with diabetes. Let us take a quick break.
So welcome back. So before we start answering some of your questions, let's take a listen to this.
Thina besicela ama-doctor atshele bangasa change ama-box wamapilisi ngoba ama-box wamapilisi mabaloku ba-change ama-kind a-confuser abantu abadala. Kunabantu abadala abangafundanga. Sometimes abantu babulala yiyo lento yokuchange ama-box ngoba umuntu uphuza ipilisi wrong acabanga ukuthi ile box lele lakudala.
It's a valid concern. It is. We're still with our guest, Dr. Sundip Ruda, endocrinologist. Now, Dr. Ruda, you've heard the concern around, the confusion that this causes. We'll come back to that because it talks to adherence to treatment. But first, let's just talk about the principles of treatment in diabetes. What are the goals?
So the goals of treatment are to control your sugar, and we use a marker called the HbA1c. And in general, the science has shown that your risk of complications is less if you can keep that below 7% in general. We may adjust the target depending on need. And then the principles of treatment is improve your diet, stay active, lose some weight, stop smoking, reduce alcohol consumption, and then take your medication and maintain contact with your doctor or healthcare provider as necessary, and regularly. Even during the COVID pandemic, it's important to maintain that contact always. Yeah.
How does one know that the treatment is working for them? I know you've mentioned the HbA1c, but are there any other ways of ensuring that adherence to treatment is actually yielding results?
Yeah, I mean, you're able to monitor your glucose by yourself at home, and the self-monitoring of blood glucose can be simple. These days there are some continuous glucose monitors available, so you can monitor your glucose throughout the day. Symptoms can sometimes be helpful. If you're feeling thirsty all the time, passing excessive urine may indicate high blood sugar, fatigue as well. So these are some simple tools you can use. Yeah.
We're going to take a quick squiz and see what some of the questions that you guys have posted on social media. The first one being a question saying, my mom is 88 years of age. She is suffering from sugar diabetes. Can you please help me with her diet? As they said that her sugar level is very high at the clinic, and that is from DTP. Please, can you help us answering that question, Doc?
So I didn't get the question there.
It's around the diet control of sugar, of
Yeah.
sugar diabetes.
And she said she was 88 years old.
She's 88 years of age.
When you're 88, you already have some habits that are difficult to break. But I think sticking to simple principles, really just avoiding the processed foods, sticking to real food, fruit, veggies, meat, chicken, fish, eating real food that nature provides. Keep it as simple as that, you'll generally be okay. And avoiding all the processed stuff would be a simple start for a lady at 88, right? Yeah.
Right. So the next question we have says, I have diabetes. Am I at high risk of getting infected with COVID-19? And this is from H. Governor from Lenasia. We may have covered this before, but just to re-emphasize the point.
Yeah, to re-emphasize, you're not more likely to get it, but you still have to practice all the measures to make sure you try not to get it, So the hygiene measures, the masking, the social distancing, hand washing is important. But what we did highlight is that if you do get it, there's a probable higher risk of severity, a severe COVID infection. And I think also to highlight in diabetic patients who get COVID, monitor your sugars more closely. You may need to stop certain medications. There are sick day rules, so you must contact your doctor. And if you feel it's getting more severe, then rather go into a hospital and have yourself checked, where they can do more intensive tests to see whether you need further intervention. Yeah.
I'll take the next question. How do I know if I have got diabetes? And that is from Sean Skuman in PE.
So we've mentioned some of the symptoms. I think if you fall into any of the higher risk groups that we mentioned, then you should screen yourself. So screening means going into a clinic or a doctor's office, a GP, where you can have a formal blood glucose test done. We do not diagnose diabetes just on a finger prick. It can be suggestive, but you need a formal blood glucose test done. And if it's above a certain level, the doctor's aware of, fasting above 7 or random above 11, that meets the criteria for the diagnosis of diabetes. So it's a simple blood test that can be done.
Let's see if we have other questions coming up. This one is from Leighton, from Naturena, says, I feel healthy. Why do I need to check my blood sugar?
So as we said, if this thing is going to develop in you, there's a big silent phase. So I think if you have any of the risk factors that we previously mentioned, Or if you're over age 45, it's important to probably check your blood sugar once a year, because before you get the full-on disease, it can be relatively without symptoms.
Let's see if there's any more. The next question is from Tabo in Soweto. I am worried that I will get infected if I go to the clinic. Is it not safer to stay at home?
So it's important to understand that not controlling your diabetes, even for the short term, can have long-term consequences. So it's important to maintain regular follow-up or checkup. In the clinic situation, as we've seen in the video, precautions have been taken. There's social distancing, there's spaces in the queues, the nurses have taken their precautions in terms of PPE, etc. So you'll be relatively safe. If you're still concerned, you can try a telephone conversation or teleconsult, and some doctors are even doing virtual consultation now. So the various avenues available, but try and maintain some contact is what we're saying. Yeah.
Let's just come back to that issue of adherence to treatment. You know, that clip that we played, I mean, the gentleman has a valid concern around the whole notion of changing packages and color of medication and so on. Let's just talk around the issue of assisting people to stick to treatment. Perhaps take us through why people need to stick to the treatment that has been prescribed for them, and how they can, get assisted in.
So adherence means to stick to a certain protocol or regimen or habit. You know? So if we take our medication regularly and on time, your likelihood of a better outcome is improved. The gentleman raises a valid concern, but I just want to mention that doctors don't intentionally change packages for fun. This relates to the various products on the market, supply issues, ordering issues, which does need attention perhaps. But what we can do as practitioners is convey simple messaging with clear labels and educate patients on the number and type of medication they have with simple messaging. This is very important. And even write it down in big letters that they can stick on the fridge or something to that effect. And adherence, I mean, at the end of the day, adherence to diet, exercise, and medication in combination will help you sustain a long, healthy life with less likelihood of complications.
We spoke a little bit about lifestyle issues, obviously the importance of regular physical activity and a diet. All right. Perhaps let's leave it for now. We'll come back. Now, we want to thank Dr. Ruda. Thank you so much for your time and your contribution to this show, and we'll always be grateful.
Thank you.
All right. So time for a quick break. When we come back, a word from one of the biggest medical aids in the country on your medical aid and diabetes medication cover. And as usual, we have a recap of the important messages that we want to leave you with. Please stay with us. Welcome back to Health 2020. So one of the questions we received is from Paul Mokhale from Benoni, who says, my medical aid is refusing to pay for the medication my doctor wants to prescribe for my diabetes. I'm told I must either accept a cheaper one or pay extra from my pocket, and yet I'm paying them every month. Well, to help us with a response to this question is our special guest today, Dr. Stan Molwabi, who's Principal Officer at GEMST. Dr. Molwabi, firstly, thank you for making Health 2020 a reality, and thank you for gracing us with your presence today. We have that one question for you, which we thought you're well placed to assist us with a response.
No, always a pleasure. And afternoon to you, Dr. Mutaung. Afternoon, Dr. Mnakisi, and to the viewers. Well, that question actually, it shows the importance of partnering with doctors in whatever we do. And that importance comes out of the fact that the medical aid never refuses, for any member or patient to get the appropriate treatment that is prescribed by the doctor. The doctor is the one who's at the forefront of everything. However, it is important that we manage this pool of funds, which belongs to all the members of the scheme. And we have to manage this pool of funds in a manner that we pay for what is appropriate and what is cost effective. Both of us, all of you are doctors here. You all remember, those basic concepts of pharmacotherapy which we must prescribe what is cost effective from a cost-benefit ratio and a risk-benefit ratio. So this is the principle that informs the basis on which we fund all the medication that the doctors prescribe. So it's not about refusing, it's about prescribing what is appropriate and what is cost effective.
All right.
Well, you heard it, guys. Here are the major insights that we got from the show today. To start off with, what exactly do you do if you've got diabetes? You can try lose weight. If necessary, you can avoid eating fast foods and sugary drinks. You can exercise every day if possible. Please make sure that you also take your medication and check your HbA1c test with your doctor. To control your sugars, especially during the pandemic, as you've heard, having higher sugars is a problem as it makes your severity of COVID worse. You aim for an HbA1c of less than 7. Ensure that you wear your mask, you wash your hands, you keep social distancing, and of course avoid touching your face and surround yourself with clean surfaces.
These are all those basic things that we always say, and this is what we recommend you keep at home. Juice, jelly, or sweets, just in case your blood sugar dips. Extra testing strips and lancets, extra batteries for your blood sugar monitor, a thermometer, and refills of your prescriptions, phone numbers of your doctor, your pharmacy, and of course a list of your medications.
That brings us to the end of the show today. We'd like to thank our special guest, Dr. Mulwabi.
And to you guys at home, thank you so much for watching, and we want to thank you especially for those questions and the other messages that you leave us on social media.
Continue to send us your questions on SMS, WhatsApp, Twitter, Instagram, Facebook, and of course on the number displayed on the screen. From my side, Salang Khantle.
And until next week, please do take care of yourselves.